Hey guys, this is Martin from Reform. I wanted to shoot a very quick video just about numbness and tingling that ends up in the hand. More often than not, it's in 1, 2, or 3 of these fingers. And this is very, very common, and it's always traceable up that nerve into the spine. So I wanted to kind of talk about the spine very briefly, but then give you 2 home care exercises to look after the scalene muscles and the pec muscle. Once the nerve gets out of the spine, it has to go through this kind of like path out here where muscles can get involved in as well. And in fact, you can have a spine and a muscle problem. So we want to make sure kind of all our bases are covered. So just for basic anatomy first, I'm not going to talk about the spine a ton. These nerves coming out of the bottom of the neck end up here. If there's a problem with a joint out of place, it's going to irritate nerves, and that's going to be the root cause. So obviously that's the first thing we want to make sure, that there's no huge problems going on in the neck, and that's where chiropractic adjustments come in. Well, a proper diagnosis, chiropractic adjustments. Okay. So once we're through that, if you're my patient, I'm shooting this for someone specific today, we want to make sure that the scalenes are not compressing that nerve at all. The stretch I'm going to show you, it's called stargazing for obvious reasons. It's almost like we're looking up at the stars, stargazing, hence the name. So you're looking around 45 degrees away, you're looking up, and you should feel this pull right down in the front of the neck here. So this stretch would be for a right-handed problem. So away up, and you hold for about 2 minutes and 15 seconds, okay? Second stretch, once you get the spine, the scalenes, next thing is the pec minor. Pec minor is a huge culprit in people who sit a lot and it gets tight. So the stretch is bringing the shoulder blades back. Use a wall or a corner in your house. The elbow should be pretty high. So it's not quite straight, but it's bent 135 degrees if you want to be specific. You come up like so, chest forward, so you're not rotating, arm up, hand, elbow on the wall, chest forward, lean. What you're going to see with that lean is the elbow goes back, the chest opens, and the shoulder blade pinches at the back. So that's kind of the Coles Notes summary. 2:15 again for this stretch. All stretches are a couple of minutes. First thing in any kind of numbness, paresthesia, tingling, burning that goes into the shoulder, elbow, or arm, make sure your spine is okay up here. Number one thing. If the spine is good, start stretching out your scalenes, start stretching out your pecs. And that's all you need to do. Ask me if you have any questions. Shoot me a message if you do. Take care.